COVID was new. Nobody knew anything about it. We had to come up with ideas for giving out information, especially to those hard to reach communities. And so we came up with this at the perfect time.
There are a lot of people, like seasonal workers especially, that come into the informal settlements. Some of them, they don't even have legal documents, so they are afraid to come to the clinic to get the services. So if we can go out there to the community and tell them you don't need a passport to come and get your child's immunization, it's free of charge, that can be a big influence in our community.
Toe ons nou pad is af vir Riverview toe gesien wat daar aangaan by die trok en die feit dat daar geneesjare is soos susters, dink ek, ja, dis iets goed.
We find out what the needs are, and based on those needs, we then develop content that will speak to those communities.
When I saw the truck, I was like, wow, it is so innovative. Little kids seeing this truck, they were captivated.
There's a loud hailing system, there's a stage. They can do all sorts of activities to attract the people.
We've been to every corner of this country. Also, the biggest thing that people like about the truck as well is the messaging. Obviously, I've learned a lot myself with operating these videos and all this content that comes on the truck.
Vir my as moeder is dit baie belangrik om inligting te kry, om net te weet wat rondom jou aangaan.
We want to raise awareness regarding hygiene, washing of hands, and the danger signs. They need to know, when is my child really sick? When do I need to take my child to the clinic or to the hospital?
We have a challenge with children that are not reaching the facility well in time, within 6 days after birth.
When you bring services to them, it really helps them. It's local languages, we make sure that it speaks to the people it's going to.
The community care workers and the community-based services are the central point between the clinic and between the community. They are working in the community where they are staying.
It was so cool also to teach people the difference between a vaccine and also immunization, just to make people understand why it is important and why they have to get their vaccinations as well as the immunizations. There were a lot of people that were also shocked that COVID is not the only disease that needs a vaccine.
We've been able to support in emergencies through the truck. There's been the measles outbreak, there's been the cholera outbreak, and we're very able to quickly, compile that information.
Ek het geleer oor borskanker wat moontlik by vroue kan voorkom. So dit is een van die dinge wat mense baie maklik weet, want vroue praat min daaroor. Ja, die trok is 'n wonderlike bewusmaker.
I think our aim overall is to make them aware, but also to support that prevention. We need to prevent further spread of disease, and we're able to do that through the truck.
And yeah, I really hope that they also had a good experience of us and that it will not be the last time.